Sitagliptin. Sitagliptin is a medicine used for the treatment of diabetes type 2. The brand name of sitagliptin is Sitagliptin. The glucoregulatory hormones, called incretins. There are two main incretin hormones in humans. Those are GIP, glucose-dependent insulinotropic peptide, also known as gastric inhibitory peptide, and GLP-1, glucagon-like peptide 1. Both GIP and GLP-1 are part of an endogenous system involved in the physiologic regulation of glucose homeostasis. GLP-1 and GIP are released by the intestine throughout the day, and levels are increased in response to a meal. Active incretins helped increase insulin synthesis and insulin release from pancreatic beta cells, particularly when blood glucose levels are elevated. In addition, active GLP-1 helps suppress glucagon release from pancreatic alpha cells, leading to decreased hepatic glucose production. These effects do not occur when blood glucose levels are low. Active incretins help the body respond to changes in glucose levels throughout the day. The activity of incretins is limited by the enzyme DPP4 or dipeptidylpeptidase 4, which rapidly degrades active incretins. In patients with type 2 diabetes, the incretin effect is decreased. Sitagliptin is the DPP4 inhibitor for the treatment of type 2 diabetes. Sitagliptin is indicated to improve glycemic control in patients with type 2 diabetes mellitus. Sitagliptin should not be used in patients with type 1 diabetes or for the treatment of diabetic ketoacidosis. Sitagliptin helps address two major pathophysiologic defects of type 2 diabetes: beta cell dysfunction and hepatic glucose overproduction. Sitagliptin blocks the DPP4 enzyme for slow down the inactivation of incretins. Sitagliptin increase the activity of GLP-1 and GIP in type 2 diabetes by inhibiting the action of DPP4 enzyme. By increasing and prolonging active incretin levels, sitagliptin increases insulin release and decreases glucagon levels. In clinical studies, the overall incidence of hyperglycemia was similar to placebo. Inhibition of DPP4 enzyme activity with sitagliptin results in increasing the insulin levels, thereby decreasing the glucose levels in type 2 diabetic patients. Leading to higher C-peptide and insulin concentrations. Sitagliptin improves the pro-insulin to insulin ratio, indicating improved insulin synthesis and release from beta cells. Sitagliptin also improves homo-beta, indicating improved fasting insulin secretion via its effects on GLP-1 and GIP. Sitagliptin significantly improves key measures of both beta cell and alpha cell responsiveness to glucose. Increased insulin release results in improved glucose utilization in the body. And decreased glucagon release results in decreased hepatic glucose production, as a result of reductions in both gluconeogenesis and glycogenolysis. Thus Sitagliptin targets two of the major pathophysiologic defects in type 2 diabetes, beta cell dysfunction, and hepatic glucose overproduction. Sitagliptin is also indicated to improve glycemic control in combination with metformin or thiazolidinedione in patients with type 2 diabetes when the single agent alone with diet and exercise does not provide adequate glycemic control. Metformin and thiazolidinedione improve insulin sensitivity.